biological and habitual differences between men and women can actually put you more at risk to contract COVID. It was something that really shocked me. So that's why we spoke to Dr. Payal Kohli about educating ourselves based on gender so we can be more prepared to fight off the disease. Dr. Kohli, welcome back to Colorado and Company. Today we're talking about gender differences in COVID, which I'm just so shocked about all of this. So let's start out. Is there a difference between men and women when it comes to taking care of ourselves during this pandemic?
So women traditionally have been the caretakers of our families. They tend to ignore their own health and focus more on the health of others. So that's certainly something to be mindful of. But during this pandemic, we're actually noticing some interesting behavioral risk factors for men, such as not washing hands as often, less likely to listen to public health advice, less likely to use soap when they wash their hands, and some behavioral factors like alcohol use and smoking that can increase risk for contracting COVID and having bad complications with COVID.
Wow. And guys, I gotta say, you heard it right here from Dr. Kohli. These are the statistics. So that's just how it is. Now, I mean, when it comes to actually getting COVID too, is there a difference in terms of gender that may be able to maybe fight it off quicker?
So, they've looked at a number of different countries and the data has been mixed, but 9 countries have reported an increased susceptibility of men contracting COVID as compared to women. Here in Colorado, the cases have been about half and half. But in terms of complications from having COVID, in Colorado, 55% of the deaths have been male and 45% have been female. So there's certainly a slight male predisposition to dying from COVID if you were to contract it. And there's a lot of possible explanations for why this might be. So estrogen is actually helps to boost part of our innate immune system, and women tend to fight viruses like HIV and hepatitis C better than men. Okay. And then in addition, the ACE2 gene, which is the receptor that the virus uses, to interact with the cell, is located on the X chromosome. So women have 2 copies and men only have 1 copy of the X chromosome. So there could be some biological differences as well, but the bottom line is men and women, not the same.
Definitely not the same. So when it comes to our biological differences, are there ways that men can maybe fight off COVID a little bit more? Is there something that they can do to make sure that they're taking care of themselves a little bit more?
So, unfortunately, there's not much we can do about our biology, but there is a lot we can do about our behaviors and about our risk factors. So remember, I talked about those 3 things, the behaviors, the comorbidities, and the biological differences. So the behaviors: wash your hands, be mindful of the fact that you could potentially be slightly higher risk. So really try to minimize the behaviors like alcohol and smoking that could increase your risk. And then the second, which is the risk factors. If you work on controlling those risk factors, diabetes, high blood pressure, high cholesterol, you really could change the course of your illness with COVID. And that's where the 9 Health screenings really come in. So 9 Health is offering low-cost screenings that you can get at a Quest Patient Service Center, which can really help you to identify these risk factors before you may even know that they're causing problems. And in that way, you can potentially change the course of your illness with COVID if you were to contract it.
Excellent. Dr. Kohli, thank you so much for joining us today on Colorado and Company, and we look forward to talking to you again very soon.
Thanks for having me.
Guys, stay ahead of your health right now. Go online right now to 9healthfair.org to sign up for a screening today. And if you have questions, 9 Health Neighbors is still up and operating with volunteers standing by to answer those questions. Give them a call at 303-698-4455, extension 2005. And make sure to tune in all month because Dr. Payal Kohli is addressing specifics about COVID and what we can do to stay safe.